When you explain that mechanism to the patients, what are the advantages of using a Flexivue
The main
Microlens?
advantage respect to the other procedures that are on the market, that Flexivue Microlens are completely reversible. So it's a complete reversible procedure. Because, in any kind of operation for presbyopia, there is some people that could complain for halos, for no neural adaptation or something else. And with all the other procedure, you cannot go back.
No.
With Flexivue Microlens, I think is the only procedure that let you go back to the previous situation.
Yeah.
So if you have some problem, if you complain of something or you cannot neuroadapt to this kind of situation, you simply should take the lens off in 30 seconds and you have a complete restitution of the integrum of the cornea.
So imagine this patient is a young patient, is 40 years old, he has presbyopia, you implant a lens on him or on her. Maybe from 5 years, I don't know, I don't see very good again. Because it's reversible, do we have any options? What can we do with a
This
Microlens?
is another advantage of the microlens because you can enhance the procedure taking off the previous lens, and you can insert a lens with more power.
Right.
So
To enhance the vision of the patient.
yes,
But as a clinic, I guess if you are treating the patient at 40 something and then at 50, and then he's going to get cataract.
okay.
So you're keeping the patient with you, but what are you going to do now? Because now the patient has cataract.
Easy to answer to this question. Yeah, for sure. With aging, the lens, the crystalline could be more yellow, and you can get cataract easily. But in this case, instead of inserting a multifocal or EDOF IOL, you simply take out the cataract and you put a monofocal IOL.
Right.
Because you have the multifocality on the cornea.
Yeah. And I'm thinking, I don't know if this is a fact, but I'm thinking if the patient is already neuroadapted for using this implant for the last 15 years, there is no risk for this patient, because sometimes multifocal lenses, you also have neuroadaptation issues. So
yeah, but the patient is still adapted.
Yes.
To the multifocal vision. So you don't need to have further adaptation.
So it's again another advantage. So in terms, still talking about patients, when we think about, imagine I'm going to your clinic now and I'm going to do this surgery. What can I expect tomorrow? What can I expect next week? What can I expect next year? What's going to happen?
You have a sort of wow effect, because the day after, say, doctor, finally, I could read easily. They have a very good performance, especially in the first day for reading.
That's a very interesting thing. And what other kind of tips do you have for the patients or for the surgeons that are considering to implant this new lens?
Yes, for the surgeon, I would say that you must be very careful for selection of the patient, especially regarding the pupillary dynamic.
Okay.
Because if you have too small pupil, maybe the patient is not suitable, and the pupil must be dynamic, so must be little when you read or in photopic situation, and must be the dilating in the mesopic or scotopic condition.
So what would it be, according to you, the minimum pupil size for
I will say 2.6 to 2.7 at least.
Okay.
The most important thing is the photopic condition.
The photopic condition is the most important. So still talking about a little bit more on the surgical side, this procedure is done with a femtosecond procedure.
Yes.
Where you create a pocket, right?
Yes.
And then you implant the lens onto the pocket.
Yes.
A couple of questions there. How deep should we go, and why should we go a certain?
That's an important question. The depth is very critical in cornea, because you don't have to insert this lens too much superficial, because in the superficial part of the cornea, the keratocyte population is very aggressive.
Right.
So you can get fibrosis and AIDS. But if you put the lens in the right depth, you don't get this kind of problem. So I say you have to put the lens at 300.
Okay.
In the study that we have, there is no effect on the endothelial cell population in any cases that we had.
Okay. What about the centration of the lens? How do you center that? How important is it? How can you give us some tips?
The center of the lens is critical, must be centered on the visual axis. And so when you make the pocket, you insert the lens, you check the patient under the excimer laser. So, and then, tell the patient to watch to the red light
On the microscope.
on the microscope or excimer laser. So you center the lens on the Purkinje reflex. And after the centration, you bring your patient in your office, check with the slit lamp and with the aberrometer. And if everything's okay, if it's well centered, the procedure is over. If it's not centered, you recenter easily the lens. You can recenter the lens even the day after or
No problem.
1 week after, because you can open easily the pocket.
Is it the pocket? And that's the same case if I need to replace the lens after 5 or 6 years or 10 years, you can do that as well.
As you know, as in LASIK, you can relieve the flap even after 10, 20 years. Is this the same thing for the pocket? You can reopen the pocket easily.
Can you tell us, just getting close to the end, but telling us something about your patient satisfaction?
It's very high. Very high satisfaction is around 95, 96% of satisfaction. And is increasing with time because as you know, there is a learning curve. So the first cases could be more tricky,
more challenging,
more challenging. But now with the experience, I can get more and more good results.
And what about the vision quality? You told us something about the vision quantity, that binocular for far, the vision is good. You get the near vision that you want, so we have some smart monovision. But what about the quality?
The quality of vision, very few patients complain of glare and halo. So I could say that it's a very good quality of vision.
So if I listen to you, this is a very safe procedure.
Yes.
It's a procedure that is
and
efficient,
the main feature is that it's completely reversible.
And it's completely reversible.
Because there is no other kind of operation that you can make for presbyopia that is reversible. Even you make an IOL implant or presby-LASIK, this is reversible.
Yes.
That's an important thing, that we have to know that we can combine this procedure with a refractive procedure. For example, if you have a patient with hyperopia, astigmatism, or myopia, you can combine the two procedures.
You can do a combined procedure and leave the dominant eye for far vision.
Yes.
While doing the microlens on the non-dominant eye for near vision. Thank you so much for your time. Appreciate it.
Thank you. Bye.